quiet doctor. Captain Veyrak had seen warships split open in vacuum. He had watched colonies burn under falling debris. He had heard distress calls from captains who knew rescue would arrive too late. But he had never heard panic like this. Orbital Mercy Hospital filled the forward display of the rescue cruiser Vanguard, hanging above the blue-white curve of the planet Hashara like a wounded silver crown. The hospital had been built by the Concordat at enormous cost, a rotating city of medicine, science, and mercy. It was supposed to be the safest place in the sector. No weapons, no military command centers, no political offices, just operating theaters, recovery wards, trauma bays, research labs, and long, quiet corridors where the sick came to be healed. Now half the station was dark. Emergency strobes flickered along its outer ring. Venting atmosphere glittered in thin white streams from 3 separate hull fractures. Docking ports flashed red. Shuttles launched in uneven bursts, some loaded with patients, some with staff, some with both, crammed together in desperate violation of safety limits. Behind the station, the local star raged. The solar storm had arrived without warning, a brutal wave of charged particles and magnetic violence that had crossed the system faster than any model predicted. It slammed into Orbital Mercy 6 hours earlier. The hospital's shields held for 9 minutes, then failed in sequence. The outer arrays overloaded first, then the communications web, then the stabilizers, then the power grid. One by one, the miracles went silent. Robotic surgical arms froze above open patients. Diagnostic fields vanished mid-scan. Medical drones crashed into walls or drifted uselessly from their stations. Automated life support entered emergency mode, then began failing bay by bay as backup reserves drained faster than engineers could reroute them. A hospital built around perfection had discovered something terrifying. Perfection needed power. Veyrak stood on the bridge with all 4 of his lower tentacles braced against the deck and his upper limbs gripping the command rail hard enough to make the metal creak. His mandibles clicked in short, tight bursts. On the main display, casualty estimates updated faster than anyone could read them. Critical patients stranded, hundreds. Operating theaters without automation, multiple. Pediatric wing emergency status, unstable. Evacuation window, collapsing. The Vanguard had arrived as quickly as physics allowed, but rescue cruisers were built to retrieve survivors, not stabilize entire hospitals during a system-wide technological collapse. They had taken aboard the first wave of evacuees. They had launched medical teams. They had cut through jammed docking collars. They had dragged patients out of powerless recovery pods and carried them to shuttle bays by hand. Still, the hospital was dying. Docking Bay 7 reports structural stress, the navigation officer said. They cannot hold connection much longer. Tell them to continue loading patients, Veyrak said. They are beyond safe capacity. Then they will be unsafe and alive. The officer's frills flattened. Yes, Captain. A second officer turned from the communication station. Captain, Administrator Liraven is still aboard. She is coordinating from the central medical hub. Patch her through? A wash of static filled the bridge. Then a ghostly image appeared. Liraven's normally elegant Sylvani features were drawn tight with exhaustion. Her silver-blue frills were collapsed against her neck. Dark streaks marked one side of her face, where smoke or burned wiring had stained her skin. Captain, she said, breathing hard. We have moved as many as we can, but the surgical wing is still occupied. Theater 4, Theater 7, Theater 9, Pediatric Trauma, Burn Ward, and the Vascular Suite. Some patients cannot be moved without immediate intervention. How many staff remain? She hesitated. Veyrak's mandibles went still. Administrator. Not enough. That meant some had left. He did not blame them. Most Concordat physicians were trained to work with advanced systems. The hospital was designed around machines that enhanced precision beyond organic limits. When those systems died, the rooms became tombs filled with instruments few of them had ever touched without robotic assistance. Doctors who had never placed a manual stitch stared at bleeding patients and did not know what to do. "Where is Dr. Hale?" Veyrak asked. Lyravin looked away for half a heartbeat. "That is the problem," she said. "He refuses evacuation." Veyrak felt the old soldier's anger rise in him. Not rage, not yet. Something colder. "Connect me to him." The signal took several seconds to stabilize. Static crackled, voices shouted in the background. Something beeped in an irregular pattern. Metal clattered. Then a human voice came through, calm, deep, and focused. "Dr. Hale. This is Captain Veyrak of the Vanguard. You are ordered to evacuate immediately. The last shuttles are departing soon." There was a short pause. Not hesitation. A man dividing attention. "Negative, Captain." Veyrak's gripping limbs tightened. "Doctor, this is not a request." "Understood." "And yet you refuse." "I have 3 patients open on tables right now," the human said. "One has a ruptured pulmonary sac equivalent. One has vascular collapse from trauma. One is a child with internal bleeding. If I walk away, they die before they reach the corridor." "The automated systems are gone," Veyrak said. "The station is unstable. Environmental control is failing. Your surgical arrays are offline." I noticed. "You are one man with primitive tools against a station-wide catastrophe." Another pause. This one carried a faint sound underneath it. Something like a breath that almost became a laugh. "Then I guess I'll be a very busy man today." Veyrak stared at the speaker as if he could intimidate the voice through it. "Dr. Hale, this is suicide." "No, Captain," Marcus said. "Suicide is walking away from people you know how to save." The bridge went quiet. Even the officers stopped moving for a moment. Marcus continued, voice even. "Send me every medic still willing to stay. Nurses, residents, orderlies, maintenance techs, anyone who can follow instructions and keep their hands steady. I need battery lights, chemical lanterns, manual ventilators, old clamps, sterile line, wound sealant, pressure packs, whatever analog instruments this place hasn't thrown away yet." "Doctor." "And Captain." Veyrak's mandibles clicked once. "Yes." "Tell them not to send me anyone looking for permission to panic. I don't have time for that." Then the line cut to static. 6 months earlier, no one at Orbital Mercy Hospital had known what to do with Dr. Marcus Hale. The Concordat's interspecies medical exchange program had been designed to foster cooperation, share treatment methods, and improve medical readiness across allied worlds. Most arriving physicians brought some advanced specialty: neural lattice repair, microvascular nanotherapy, adaptive organ synthesis, non-invasive tissue regeneration, predictive disease modeling. Dr. Marcus Hale arrived with a duffel bag, an old leather case, and his hands. He was a human male in his mid-50s, broad-shouldered, steady-eyed, with dark brown skin, salt and pepper hair cropped close, and a calmness that made him seem slower than he actually was. He spoke gently. He listened more than he talked. He had the kind of presence that did not fill a room by force, but somehow made the room adjust around him. Administrator Lyravin had not been impressed. She remembered his orientation clearly, mostly because she had been certain it would be brief. He stood beside her in the observation gallery above Surgical Theater 7, watching 3 robotic arms rebuild a patient's damaged vascular lattice, with movements too fine for most species to perceive. Light passed through the patient's tissues in controlled pulses. Tissue bonded at the molecular level. No incision, no bleeding, no crude mechanical intrusion. Liravan had let him watch for a while before speaking. "This is standard procedure for us," she said. "The patient will recover within 12 hours. Marcus nodded. "Impressive. You still perform open surgery on Earth?" "When we need to." "With scalpels?" "Yes." "And clamps?" "Yes." "And sutures?" He glanced at her. "Also yes." Her frills lifted in polite disbelief. "Dr. Hale, I mean no disrespect, but your methods appear extremely invasive." "Sometimes life is invasive. Our systems repair tissue at the molecular level. We use predictive models to guide every intervention. Our surgical fields compensate for tremor, blood loss, tissue variation, and operator fatigue. What possible value could manual cutting and stitching add here?" Marcus looked down through the glass. The robotic arms moved like silver insects in perfect coordination. "You ever lose power?" he asked. Liravan blinked. "Not in any way that matters." "That wasn't my question." "We have triple redundancies." "That wasn't my question either." Her frills tightened slightly. "Very rarely." Marcus nodded. "Machines are wonderful. I use plenty of them. But sometimes the scan is wrong. Sometimes the model misses something. Sometimes the power goes out. Sometimes the fancy tools break. And sometimes a patient is bleeding right now, not after diagnostics finish." Liravan studied him with careful professional restraint. "And then?" He held up his hands. "Then you want the doctor who still knows what to do with these." For the first month, most of the staff treated him like a historical exhibit. The human doctor who still tied knots. The human doctor who could identify major vessels by touch. The human doctor who insisted every resident should know how to maintain an airway without a machine, stop bleeding without a coagulation field, and close a wound without a bonding laser. Some smiled at him kindly. Some avoided his classes. Some watched with amused curiosity while he taught knots on strips of synthetic tissue and practiced emergency incisions on old analog trainers he had found buried in a storage wing. Only the youngest came regularly at first. A Crix nurse named Thera, all delicate claws and nervous energy, stayed after one session and asked him why humans were so comfortable touching injury directly. Marcus had considered the question. Because for most of our history, we didn't have a choice. That sounds frightening. It was. Then why teach it? Marcus smiled faintly. Because fear is a terrible teacher during the emergency. Better to learn before. By the 3rd month, his reputation had changed slightly. Not much. Enough. During a minor power fluctuation in the trauma wing, he manually stabilized a Geller patient whose respiratory implant locked open. While the attending physicians waited for diagnostic reboot, Marcus had already identified the airway issue, bypassed the implant, and kept the patient oxygenated with a hand pump and a maintenance tube. During a shuttle accident, he organized triage faster than the hospital system could classify injury types across species. He did not wait for the board to assign colors. He walked the line, pointed, and spoke with quiet certainty. Immediate. Delayed. Walking wounded. Operating theater now. A Silvani resident protested that the system had not finalized priority. Marcus pointed to a patient whose blood pressure equivalent was collapsing. That one doesn't have time for your system to make up its mind. The patient survived. After that, more residents came to his classes. Lyravan noticed, though she did not comment. She noticed the human never mocked their technology. He admired it. He learned it. He used it well. He simply refused to worship it. That refusal had seemed quaint. Until the storm. Operating Theater 7 smelled like overheated circuitry, sterilizer vapor, and blood. The main lights flickered once, twice, then died completely. For half a second, the room plunged into absolute darkness. A young nurse screamed. "Quiet," Marcus said. Not loud, not harsh. Just enough authority to cut through panic. Everyone froze. Lanterns on. Chemical lanterns cracked to life around the theater, one by one, spilling warm gold across metal trays, pale walls, and the open body of a young Vrillian girl on the table. The glow shook in the hands of those holding it. Shadows moved across the surgical field. Marcus adjusted the headlamp strapped over his hair and leaned closer. "Thera, I need suction." "The suction unit is dead." "Manual bulb?" "I don't." "Left tray. Blue handle. You practice this." Thera's claws trembled as she grabbed it. "That's it," Marcus said. "Pressure steady, not too hard. Let it work." The patient's monitor gave a weak, irregular tone from a battery pack. The screen showed symbols Marcus had learned but still translated in his head. Vrillian anatomy was not human anatomy. The organs sat differently. Blood pressure worked across a dual pulse system. Their clotting response could cascade too fast if mishandled. But bleeding was bleeding. Shock was shock. A body trying to die had a language of its own. "Clamp." A Silvani resident stared at him. "Clamp," Marcus repeated, still calm. The resident fumbled and handed him the wrong instrument. Marcus did not snap. He did not sigh. He did not waste anger on fear. "That's a retractor. Clamp is shorter, curved tip, silver grip." The correct tool landed in his palm. He placed it with a precision that made Thera's breathing catch. The bleeding slowed. "Good," Marcus said. "Now everybody listen to me. Machines are offline. That does not mean medicine is offline. We are going to keep doing the job, one step at a time. No one moves unless they know why they are moving. No one speaks unless the information helps the patient. Understood?" A scattered chorus answered. "Understood." Marcus glanced at the girl's face. She was unconscious, small for her species, pale lavender skin gone too gray around the mouth. "What is her name?" Thera swallowed. "Avon." "Then Avon is the only thing in this room that matters." He held out his hand again. "Suture." On the Vanguard, Captain Veyrak watched the hospital's status board deteriorate. Emergency power in surgical wing, unstable. Life support in pediatric recovery, partial failure. Burn ward temperature regulation, offline. Internal transport systems, inoperable. Manual evacuation paths, obstructed. He had fought enemy fleets less stubborn than this storm. Administrator Lyravan reports Dr. Hale has stabilized Theater 7, the comm officer said. Veyrak turned. The child? Alive. And the others? 2 additional patients stabilized. He is moving to another theater. Veyrak stared. Moving? Yes, Captain. He has been operating for how long? Nearly 3 hours since first contact. And he is moving? The officer's throat sac flexed. Yes. Veyrak looked back at the hospital. The dark sections seemed to spread like infection. "Patch me to Liravan." The administrator appeared again. She was walking now, the image shaking with her steps. Behind her, the central medical hub had been converted into something between a command post and a refugee shelter. Injured patients lay on emergency pads. Staff moved by lantern light. Someone was crying. Someone else was calling for sterile water. "Report," Veyrak said. Liravan looked toward someone off-screen. "Careful with that line. Keep it elevated." Then back to him. "Dr. Hale has created manual triage stations across the surgical wing. He divided the remaining staff into teams. One handles airway and breathing support, one handles bleeding control, one handles transport, one handles children." "How many has he saved?" Her mouth tightened. "Confirmed? More than 30. Possibly more. We are still counting." Veyrak made a low sound in his throat. Liravan's voice changed. Softer now, confused in a way she did not try to hide. "They are calling him the Lantern Doctor." "Who is?" "The staff, patients, everyone." Her eyes shifted again, following movement beyond the screen. "He never stops. He never raises his voice. When someone freezes, he gives them one clear task. When patients panic, he speaks to them as though the station is not falling apart." The comm crackled. Marcus's voice broke through on a secondary channel. "Central, this is Hale. Theater 9 is stable. I'm moving to Burn Ward. I need 2 medics, more line, more lanterns, and somebody find me the oldest surgical kit on this station." Liravan answered quickly. "Doctor, you must rest." "No. You are past safe fatigue limits. So are the patients." "Marcus?" His voice softened, but did not slow. "Lyra, send the kit." The channel clicked. Veyrak studied the administrator's face. "You called him primitive," he said. Liravan looked at him. There was no accusation in Veyrak's voice, only memory. She lowered her eyes. "Yes." The burn ward was hotter than any room in a hospital should have been. Environmental control had failed there first. Heat built under sealed doors and half-powered vents. The air carried a sharp chemical tang. Several patients had been injured when a power conduit blew during the first wave of the storm. Different species burned differently. Different skin structures blistered, split, sealed, or crystallized. The automated burn tanks were offline, half full, and useless. Marcus entered with his gown already stained and his shoulders aching. A Kelran orderly hurried beside him, holding a lantern high. Thera followed with a case of supplies pressed to her chest. 2 Silvani residents trailed behind, both pale, both too frightened to pretend otherwise. The room went quiet when Marcus stepped in. Patients looked at him. Some knew him now. Some only knew the rumor spreading through the station faster than the emergency alerts. The human was still here. The human knew what to do. The human had brought light. Marcus paused at the entrance, scanning. He saw the worst cases first. That was habit. Not because they were loud. Often the loud ones could wait. It was the quiet ones he looked for. The too still, the unfocused eyes, the shallow breathing, the body no longer wasting energy on complaint. He pointed. "You. Pressure dressing on that wound. You. Check airway on the second bed. Thera, with me." A child's voice whimpered from the far side of the room. "Dr. Marcus?" He turned. A small Silvani boy lay curled on a treatment pad, one side of his body covered in translucent gel that had begun to dry at the edges. His frills were torn, his breathing fluttered. Marcus remembered him. Tavi. He had come in 2 months earlier for a minor respiratory repair and spent the entire procedure asking questions about Earth animals. He had been fascinated by turtles. Marcus crossed to him. "Hey, Tavi. It hurts." "I know, buddy." The machine stopped. "I know. Is it going to come back?" Marcus knelt beside him, ignoring the complaint from his knees and the burn of fatigue in his back. "Maybe. But we're not waiting on it." Tavi's eyes glistened. "Am I going to die?" The room seemed to hold its breath. Marcus looked at him directly, not with false cheer, not with panic, with respect. "Not if I can help it." Tavi trembled. "Can you help it?" Marcus smiled, small and tired. "I've been known to be stubborn." The boy made a weak sound that almost became a laugh. Marcus looked up. "We need fluids, clean dressings, and I need someone fanning air through this room. Not at the wounds. Across the room. Keep the heat moving." One resident blinked. "Fanning? Air moves heat. Heat hurts patients. Move the air." "But the ventilation system is dead. Your arms are not." The resident stared for half a second. Then she grabbed a sterile panel and began moving air. Marcus worked. He did not have enough medication. He did not have enough light. He did not have enough trained hands. He did not have the tools he wanted, the systems he preferred, or the conditions any sane surgeon would demand. So he used what he had. He cooled burns with carefully rationed sterile fluid. He cut away dead tissue when waiting would invite infection. He showed Thera how to hold pressure without crushing fragile Sylvani vessels. He taught the residents to watch skin color, breathing rhythm, pupil response, pulse strength, and the 1,000 small signs machines usually noticed for them. "Look at the patient," he said again and again, "not the dead screen, the patient." At some point, someone began humming. A low tune, soft, human. Thera noticed first. Marcus was singing under his breath, not performing, not even fully aware of it. An old Earth song, slow and steady, worn smooth by memory. The words made little sense through translation, but the tone did. It filled the gaps between alarms. It gave frightened children something to follow, besides pain. Tavi's breathing steadied. The Sylvani resident fanning the air began to move in rhythm with the song. Then another nurse joined in, not knowing the words, only the shape of the melody. For 3 minutes, inside a dying orbital hospital lit by chemical lanterns, surrounded by failing machines and wounded children, the room had a heartbeat again. By the 5th hour, Dr. Marcus Hale had become a rumor with bloody sleeves. In vascular, he stopped a catastrophic bleed with 2 clamps, a strand of surgical line, and a glare so calm that the panicking resident apologized to him while passing instruments. In pediatric trauma, he used the casing from a broken diagnostic wand as an improvised splint for a species with hollow bones. In recovery, he organized patients by who could survive transport, who needed immediate intervention, and who simply needed someone to sit beside them and tell them the dark did not mean they were forgotten. He sent maintenance workers to pry open jammed storage cabinets. He sent administrators to carry water. He sent frightened specialists to hold lanterns. He sent one senior physician, who insisted nothing could be done without neuro-guided micro-tools, to sit with an elderly patient and keep manual pressure on a wound. When the physician protested, Marcus looked at him for the first time with something sharp in his eyes. "You want something advanced? keep someone alive with your hands. The physician sat down. He kept pressure. The patient lived. Marcus did not think about heroism. He did not think about how many he had saved. He did not think about death unless it stood directly in front of him and demanded negotiation. He thought in steps: airway, bleeding, circulation, pain, shock, move, next patient, next room, next breath. His hands hurt by then. The skin beneath the gloves had blistered where sweat and motion rubbed raw spots into his palms. His shoulders trembled when he held them still too long. His eyes burned from smoke and chemical glare. More than once, he steadied himself against a wall and waited for the corridor to stop tilting. Thera saw it. "Doctor," she whispered, "you are going to collapse." "Probably." "That is not acceptable." "Agreed." "You need to stop." He looked through a cracked observation panel into the next ward. A young patient lay on a cot, while two nurses struggled to keep a manual ventilator going at the right rhythm. Marcus pushed off the wall. "After that one." "You said that 4 patients ago." "Then I'm consistent." She made a frustrated clicking sound. He glanced at her. "Thera." She looked up. "You're doing good work." Her claws tightened around the supply case. "I am terrified." "I know." "How are you not?" Marcus's expression softened. "I am." She stared at him. He nodded toward the ward. "I just don't let it drive." The storm began to weaken in the 6th hour. Not all at once. Nothing about disaster ended cleanly. First, a section of backup power returned to the lower ring. Then one communication relay stabilized long enough for the Vanguard to establish a stronger link. Then medical teams from the rescue cruiser forced open a service dock and entered through a maintenance spine carrying portable generators, plasma cutters, and field kits. They expected to find chaos. They found organization, not calm, not order in the elegant Concordat sense, something rougher. Lanterns marked triage zones. Colored strips of torn, sterile wrap indicated patient priority. Manual ventilation teams rotated every few minutes to prevent fatigue. Wounded staff continued working from chairs. Patients who could speak were helping soothe those who could not. And everywhere, someone had written the same words on walls, doors, and supply crates. "Listen for Hale." A rescue team found him in the main recovery ward. He was seated between 2 patient beds, still wearing his blood-stained surgical gown, one gloved hand resting lightly on the wrist of a sleeping Vrilian girl, monitoring pulse by touch. On the other side, Tavi slept beneath a warming sheet, his breathing shallow but steady. Marcus's head had tilted back against the wall. His eyes were closed. For one alarmed moment, the lead rescuer thought he was dead. Then Marcus opened one eye. "You the cavalry?" The rescuer froze. "Dr. Hale?" "That's what they keep calling me. We are here to relieve you." "Good." Marcus tried to stand and failed the first time. Thera caught his arm. He gave her a grateful look, then pointed weakly toward the far side of the ward. "Vascular patient in Bay 3 needs recheck in 10 minutes. Burn dressings on the Silvani boy need moisture. Girl beside me needs monitoring for secondary bleed. Don't trust the first scans when they come back online. Machines get confused after trauma and power loss." The rescuer stared. Marcus blinked slowly. "You writing this down?" "Yes, doctor." "Good." Then his knees gave way. Thera and the rescuer caught him before he hit the floor. On the Vanguard, Captain Veyrak received the final casualty update while the storm faded behind the planet. He read it once. Then again. Then he sat down slowly in the command chair. "Captain?" his first officer asked. Veyrak did not answer immediately. The numbers were not clean. They never were. Many had died before rescue could reach them. Several sections of the hospital had been too badly damaged. Some patients were too fragile when the power failed. But in the wings where Dr. Hale had worked, where lantern teams had followed his voice through smoke and darkness, the survival rate was impossible. Not unlikely. Impossible. By Concordat projections, based on power loss, staff depletion, and severity of injury, most of those patients should have died. They had not. The first officer leaned closer. How many directly attributed to Hale's intervention? Veyrak looked at the display. More than 80 confirmed. Possibly more as records are reconstructed. The bridge was silent. Finally, the comm officer spoke softly. "They are asking permission to transfer Dr. Hale aboard for treatment." Veyrak's mandibles clicked once. Granted. "And Administrator Liravin requests that he be listed as mission-critical medical personnel." Veyrak looked toward the damaged hospital on the forward display. Mission-critical. A primitive human surgeon with old tools and raw hands. "Yes," he said. "List him as mission-critical." 3 weeks later, the Concordat Medical Council convened an emergency session on Centralis Prime. It was not held to assign blame. Not officially. Concordat committees were too polite for that. The purpose was review, reconstruction, and future risk mitigation. But everyone knew the truth. Orbital Mercy had nearly become a monument to arrogance. Delegates from over 200 species filled the grand chamber, their bodies arranged according to oxygen needs, gravity tolerance, diplomatic rank, and ancient custom. Above them, hollow screens replayed sections of recovered footage from the disaster. The first clips showed failure. Robotic arms frozen in place. Dark operating theaters. Patients crying out as automated systems died. Staff unable to access equipment because doors had sealed without power. Then the footage changed. A single lantern snapped to life. Dr. Marcus Hale stood in gold light, face slick with sweat, eyes focused, one hand extended. "Clamp." The next clip showed him guiding Thera through manual suction. The next showed him kneeling beside Tavi. The next showed him drawing triage zones on the floor with a marker because the digital displays were dead. The next showed him singing. The chamber made no sound during that part. The audio was poor. Static cut through the melody. Several words failed to translate. It did not matter. Every species understood the tone. Captain Veyrak stood before the council when the presentation ended. His uniform was formal, his posture rigid. His voice carried through the chamber without amplification. "We believed Orbital Mercy Hospital was protected by its technology," he said. "We believed redundancy was the same as resilience. We believed that because our systems could perform miracles, we no longer needed the older skills that came before those miracles." He turned slightly, looking toward the witness chair. Marcus Hale sat there in a simple dark tunic, one hand bandaged, his face still marked by fatigue despite 3 weeks of enforced recovery. He looked uncomfortable with the attention, not frightened, not impressed, just uncomfortable, as if all of this was making a simple thing unnecessarily complicated. Veyrak continued. Dr. Marcus Hale was ordered to evacuate. He refused. At the time, I considered this insubordination. I now recognize it as fidelity to a duty older than protocol. No one moved. When the machines failed, he did not ask what system would replace them. He became the system. When the lights died, he asked for lanterns. When the robotic arms froze, he used his hands. When our staff panicked, he gave them purpose. When children cried in the dark, he sang to them. Vayroc's mandibles lowered, a gesture of deep respect among his people. We called human medicine primitive. That word will not be used again in my presence. A low ripple moved through the chamber. Not applause, something deeper. Vayroc faced Marcus fully. You stayed when leaving would have been reasonable. You worked until your body failed. You saved lives that our models had already counted as lost. The Concordat owes you a debt it cannot repay. Marcus was quiet for a moment. Then he leaned toward the microphone. I appreciate that, Captain. His voice was still rough. But I need to be clear about something. The chamber waited. I didn't save those patients alone. Thera stayed, Lyroven stayed, nurses stayed, residents stayed, orderlies stayed, maintenance crews stayed. Some of them were scared out of their minds, but they stayed anyway. He lifted his bandaged hand slightly. These hands mattered. So did theirs. Lyroven sat among the medical administrators, very still. Marcus looked across the chamber. Technology is good. I'm not here to tell you otherwise. I've seen your machines do things that would make Earth surgeons weep with envy. But tools are not courage. Systems are not judgment. Automation is not compassion. And no machine, no matter how advanced, should be the only thing standing between a patient and death. He paused. His expression did not harden exactly. It settled. When the machines fail, you don't walk away from people who need you. You find a way. That's all I did. For a long moment, the chamber remained silent. Then Lyroven rose. The gesture was not part of the schedule. A Sylvani administrator of her rank did not stand during testimony unless making formal objection or offering formal honor. She stood anyway. One by one, others followed. Vayroc rose, then the council delegates, then the observers, then the entire chamber. Marcus Hale looked down at his hands. He had seen applause before. Standing ovations after medical conferences, awards ceremonies, political theater. This was not that. This was hundreds of species acknowledging a truth they should not have forgotten. Mercy did not begin with machines. It began with someone refusing to leave. In the years that followed, Concordat hospitals changed, not quickly. Large systems never did anything quickly unless disaster chased them. But the changes came. Manual surgical training returned to the curriculum. Emergency analog kits were stocked in every operating theater. Battery lamps and chemical lanterns became mandatory in critical care wards. Medical residents were required to demonstrate hand skills without robotic assistance. Life support teams practiced full blackout drills. Administrators complained about cost. Engineers complained about redundancy. Physicians complained about old techniques. Then they saw the Orbital Mercy footage. Most stopped complaining. The new emergency doctrine had an official title that was long, precise, and impossible to remember. No one used it. Across Concordat space, doctors called it something else. The lantern rule. When power fails, medicine continues. When systems collapse, training remains. When automation dies, hands take over. And in every major hospital, somewhere near the emergency manual kits, there was a simple line added beneath the protocol. If available, call for the human doctor. Marcus Hale returned to work after recovery. He refused statues. He refused political appointments. He refused to let anyone name a surgical wing after him while he was still alive, which annoyed 3 committees and delighted the nursing staff. He went back to teaching. His classes were full now. Silvani residents, Creeks nurses, Kelran trauma specialists, Vrillian pediatric surgeons, and physicians from worlds that had once politely dismissed him as a relic crowded into simulation rooms to learn knots, pressure, airway control, field triage, and the discipline of looking at a patient before looking at a screen. Thera became his chief assistant. She stopped trembling when she passed instruments. Mostly. Sometimes, when new students grew too confident in the machines around them, Marcus would dim the lights without warning. A lantern would glow at the center of the room. The students would go quiet. Marcus would hold up his hands and say, "Begin." And they would. Years later, children who survived Orbital Mercy would tell the story differently depending on their species, their memories, and how young they had been when the lights went out. Some remembered the heat. Some remembered the dark. Some remembered pain. Some remembered a human voice singing in a language they did not understand. Tavi remembered the doctor kneeling beside him and saying, "Not if I can help it." Avon remembered waking up beneath golden light and seeing a tired man smile like the universe had not just tried to take her. Captain Veyrak remembered the voice over static. "Negative, Captain." Administrator Liravin remembered a question. "You ever lose power?" The galaxy remembered the lesson. The quiet doctor had not defeated an armada. He had not fired a railgun, broken an empire, or stood on a battlefield beneath falling stars. He had done something older. He had stood in a failing hospital with lantern light on his face, blood on his hands, fear all around him, and patients who still needed saving. And when every advanced system went silent, when every elegant machine failed, when the future itself seemed to go dark, one human doctor reached for a scalpel, steadied his hands, and went back to work. Because humans had learned long ago that healing was not born in perfect rooms. It was born in caves, tents, ships, trenches, disaster zones, and burning cities. It was born wherever someone hurt and someone else refused to give up on them. They called him the Quiet Doctor. And across the Concordat, whenever emergency lights flickered and the machines hesitated, doctors remembered the rule he left behind. Find a light. Use your hands. Do not let go.
If you enjoyed this story and want to hear more tales of humanity rising among the stars, please like, comment, and subscribe. New stories are released regularly here on Empyrean Chronicles.